Good afternoon. This is All India Radio. I am Valsa Williams and with me is Subhaga Kaul with the Midday News. The headlines. Prime Minister Narendra Modi says India is ready to provide all possible help to its friendly nations in the wake of the COVID-19 pandemic. Asian Development Bank assures India of $2.2 billion support to fight the pandemic. United Nations Chief Antonio Guterres says implications of the pandemic will be far-reaching, affecting international peace and security. Centre and state governments making all efforts to identify hotspots to contain spread of COVID-19. And Good Friday being observed across the globe today. India is ready to do whatever is possible to help its friendly nations in the wake of COVID-19 outbreak. Responding to Israeli Prime Minister Benjamin Netanyahu, who thanked India for delivering hydroxychloroquine to his country, Prime Minister Narendra Modi said the two nations have to jointly fight this pandemic. In a tweet, the Prime Minister said he is praying for the well-being and good health of the people of Israel. The Prime Minister also thanked Brazilian President Jair Bolsonaro. Prime Minister Modi said the India-Brazil partnership is stronger than ever in these challenging times. He added that India is committed to contribute to humanity's fight against this pandemic. Earlier, the Brazilian president had thanked Prime Minister Modi for facilitating export of raw materials to Brazil for production of anti-malarial drug hydroxychloroquine, seen as a possible cure for COVID-19. Asian Development Bank today assured India of $2.2 billion support to fight against the COVID-19 pandemic. ADB President Masatsugu Asakawa commended the Indian government's decisive response to the pandemic, including a national health emergency program. He commended tax and other relief measures provided to businesses. ADB President and also appreciated 1.7 lakh crore rupees economic relief package to provide immediate income and consumption support to the poor, women and workers affected by the nationwide lockdown. ADB in a statement said that weakening global economic growth is causing disruptions in India's trade and manufacturing supply chains, along with the slowdown in tourism and other economic activities. ADB said it is also engaged with the private sector to meet its financing needs during this period. On the 18th of March, ADB announced an initial package of approximately $6.5 billion to address the immediate needs of its developing member countries, including India, as they respond to the COVID-19 pandemic. It added ADB stands ready to provide further financial assistance and policy advice whenever the situation warrants.
United Nations Chief Antonio Guterres said that COVID-19 pandemic poses a significant threat to the maintenance of international peace and security. He added it will potentially lead to an increase in social unrest and violence that would greatly undermine our ability to fight the disease. Mr. Guterres described the battle against COVID-19 as the fight of a generation and the raison d'etre of the United Nations itself. While the COVID-19 pandemic is first and foremost a health crisis, its implications are much more far-reaching.
The focus of all political parties should be to save their people. Please don't politicize this virus. We're close to every nation. We're colorblind. We're, wealth blind. We don't see. For us, rich and poor is the same. For us, weak and strong is the same. The United States and China should come together and fight this dangerous enemy. They should come together to fight it. And the rest of G20 should come together to fight it. And the rest of the world should come together to fight it.
The Secretary General was addressing the first UN Security Council meeting on coronavirus crisis in a closed video conference session. The meeting was under the presidency of the Dominican Republic. Mr. Guterres said the pandemic was provided a window into how a bioterrorist attack might unfold across the world. He issued a strong warning that non-state groups could gain access to virulent strains that could pose similar devastation to societies around the globe. The UN chief stressed that the crisis has hindered international, regional and national conflict resolution efforts exactly when they are needed most. Another significant risk posed by the pandemic is that it is triggering or exacerbating various human rights challenges, and refugees and internally displaced persons are particularly vulnerable. According to estimates from Johns Hopkins University's Coronavirus Resource Center, there are more than 1.6 million confirmed COVID-19 cases across the world, and over 95,000 people have died so far of the disease. India has said it is for each member state of South Asian Association for Regional Cooperation (SAARC) to decide in the timing, manner and implementation of their SAARC COVID-19 Emergency Response Fund commitments. External Affairs Ministry spokesman said, as far as India is concerned, the commitment made by Prime Minister Narendra Modi is today in an advanced stage of implementation. Assistance in material and services has been extended to Afghanistan, Bangladesh, Bhutan, Maldives, Nepal and Sri Lanka. The spokesman said these SAARC countries have also made early commitments to the fund, and the degree of seriousness of each nation can be gauged by their behavior. External Affairs Ministry's comments came in the wake of Pakistan pledging $3 million to the SAARC COVID-19 Emergency Response Fund, proposed to be used through the SAARC Secretariat in accordance with the SAARC Charter.
Prime Minister Narendra Modi today said India stands in solidarity with Nepal in the common fight against COVID-19. The Prime Minister spoke to Nepalese Prime Minister KP Sharma Oli and discussed the prevailing situation. Prime Minister Modi also appreciated the determination of the people of Nepal to fight this challenge. Prime Minister Modi also spoke to Japan's Prime Minister Shinzo Abe about the pandemic. He said the special strategic and global partnership can help develop new technologies and solutions for the post-COVID world, for the Indo-Pacific region and for the world. Nearly 200 Indian-American organizations have praised the people of India for showing fortitude and discipline in their fight against the coronavirus pandemic. The pandemic has claimed over 95,000 lives across the world. In a message of solidarity, these Indian-American organizations said they salute the efforts of all those individuals who, along with international organizations, national governments and private, public and social sector organizations, are working tirelessly at a huge personal risk to tackle this crisis and save precious human lives. A total of 678 new confirmed cases of novel coronavirus have been reported in the country during the last 24 hours, taking the total number of cases to 6,412. Health and Family Welfare Ministry said 504 patients have recovered so far and 199 deaths have been reported in the country. The Indian Council of Medical Research has said that a total of 1,44,910 samples have been tested so far, including 16,002 samples which were tested yesterday. ICMR has approved 139 government laboratories and 3 collection centres in the country to conduct the test of COVID-19. In addition, 67 private laboratories chains have also been given approval for the testing. Meanwhile, Health and Family Welfare Ministry has placed the order for 1,70 lakh personal protection equipment and 49,000 ventilators. The supply has already been started.
The central and state governments are in a continuous combat mode against the novel coronavirus. Areas which are at higher risk of wider spread of the infection are earmarked as hotspots to contain any further spread. Delhi added 5 new places, taking the total tally to 25 of such hotspots in the national capital. Bengali Market, Shastri Market in JJ Colony, Sadar Bazar, B1 and B2 blocks in Paschim Vihar, Nizamuddin Dargah and Nizamuddin Basti were the new demarcated hotspot zones. Government has urged citizens to support the call of no movement in such areas. More details from our correspondent.
Demarcation of hotspots is one of the most viable strategy for containment of a contagious disease. By such demarcation, effective monitoring and sanitization of areas become fairly feasible for the enforcement agencies. Government is constantly keeping a watch over the situation, and new areas are added to the list for better strategic approach. In country's fight against corona, residents are seen to be abiding to the no stepping outdoors rule. On the other hand, district authorities are working tirelessly to ensure that essential supplies reach the doorsteps of every resident, avoiding any inconvenience to them. Apurti Seva Suvidha app is being used by Noida authorities, and such other online portals are engaged by other state governments to embolden citizens in their pledge to defeat this global contagion. Anand Chaturvedi, AIR News, Delhi.
Union Health Minister Dr. Harshvardhan today held a meeting through video conference with state health ministers to review actions and preparedness of states to manage COVID-19. Minister of State for Health Ashwini Kumar Chaubey and senior officials of the ministry were also present in the meeting. Health and Family Welfare Ministry has issued an advisory to stop the social stigma associated with COVID-19. This advisory came in the wake of reported cases wherein corona patients, frontline workers like doctors and nurses, certain communities and areas faced discrimination due to fear and misinformation about coronavirus. More from our correspondent.
Health Ministry has urged on the need to counter such prejudices and advised that through social distancing and personal hygiene, this disease can be eliminated. It has been advised to the people to follow certain steps to end the social stigma associated with novel coronavirus. Healthcare professionals and sanitary workers who are providing their services in this difficult situation deserve people's support and appreciation. Do not target healthcare professionals, sanitary workers and police. Names or identity of affected person and their locality shouldn't be shared on social media. Do not label any community or area for spread of coronavirus. Avoid spreading fear and panic. With Diwakar, Bhupendra Singh, AR News, Delhi.
Delhi police has booked 32 people for stepping out of their homes without wearing masks. A senior police officer said these people are from northwest region of the city, including Adarsh Nagar, Netaji Subhash Place and Shakurpur. The Delhi government has made it compulsory for people to wear face masks when stepping outdoors to combat the COVID-19 spread in the national capital.
Employees Provident Fund Organisation, EPFO, has processed about 1.37 lakh claims, disbursing 279.65 crore rupees under a new provision to help subscribers fight COVID-19. This provision is specially formulated by amending the EPF scheme. The remittances of the money have already started taking place. The system as it stands today is processing all applications which are fully KYC compliant within less than 72 hours. The provision for a special withdrawal from the EPF scheme to fight COVID-19 pandemic is part of the Prime Minister's Garib Kalyan Yojana announced by the government. EPFO is also accepting the date of birth recorded in the Aadhaar card of a subscriber as a valid proof of rectification of the date of birth in PF records. The Institute of Chartered Accountants of India, Institute of Company Secretaries of India and Institute of Cost Accountants of India, the three professional institutes under the Ministry of Corporate Affairs, have come forward to donate 28.80 crore rupees to PM CARES Fund. It is to provide assistance to those impacted by the COVID-19 pandemic. The Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund, PM CARES Fund, was created on 28th of March following the COVID-19 pandemic in India. This dedicated national fund has been set up with the primary objective of dealing with any kind of emergency or distress situation as posed by the COVID-19 pandemic and to provide relief to the affected people.
The Union government has dismissed a viral audio clip circulating on social media which claims that vegetable sellers are spreading COVID-19 by licking or spitting on vegetables and fruits. In a tweet, Press Information Bureau clarified that the claim made in the audio clip is false and intended to create disharmony in society. In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Dr. Rakesh Garg, professor in AIIMS, New Delhi, said the act of following lockdown measures and social distancing by the people will play a major role in containing the coronavirus.
If the social isolation continues in a very nice way, then probably we'll be able to have containment. So there may be some clusters which are upcoming, but with good contact tracing and with good quarantine of those who have suspects or those who have contact with these positive patients, if they can do a good amount of quarantine at respective places, then probably we think that the containment of the virus may be a good option, and we hope that it would happen.
Dr. Sanjay Pandey of Govind Vallabh Pant Hospital, New Delhi, said initial symptoms of common flu and COVID-19 are the same.
In a common flu and COVID-19, the initial symptoms are same. Like patients has upper respiratory tract infection, like running nose, sneezing, cough. But in 10 to 15% patients of COVID-19, there can be some respiratory problem, and these problems are more common in elderly patients and patients who are having some underlying disorder like hypertension, diabetes. So this is how we differentiate between the two conditions.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Lieutenant General Ved Chaturvedi, Senior Consultant of Rheumatology and Clinical Immunology, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. Repeat, 1800-115767. You can also ask questions on telephone number 011-2331-4444. Repeat, 011-2331-4444. And post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:10 p.m. onwards. This program will also be available on our website, newsonair.com, and on our YouTube channel, News on AIR Official. You can also follow us on the News on AIR app for updates.
Researchers from Mohali-based Institute of Nanoscience and Technology, an institute under the Department of Science and Technology, have made computer-based designs of nanomaterials with super-high piezoelectricity, which are slated to be used for making ultra-thin nanotransistors. The research will help development of nano devices like transistors, which are used in the motherboard of computers and laptops. This will help in further minimizing the size of electronic devices, making them lighter and easy to carry.
Indian Navy Chief Admiral Karambir Singh has asked the Navy personnel to ensure that vital operational assets such as ships and submarines remain free from coronavirus. In a video message to all Navy personnel, he said coronavirus pandemic is unprecedented. The Navy Chief said its impact has been extraordinary across the globe, including India, and the Navy needs to double its efforts to ensure that personnel and their families continue to remain safe. He also said the armed force is ready to assist other countries in Indian Ocean region.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi says India is ready to provide all possible help to its friendly nations in the wake of the COVID-19 pandemic. Asian Development Bank assures India of $2.2 billion support to fight the pandemic. United Nations Chief Antonio Guterres says implications of the pandemic will be far-reaching, affecting international peace and security. Centre and state governments making all efforts to identify hotspots to contain spread of COVID-19. And Good Friday being observed across the globe today. For quick news updates round the clock, follow us on Twitter handle @AIR News Alerts.
The Haryana government has decided to double the salary of doctors, nurses and other medical professionals dealing with coronavirus patients. Haryana Chief Minister Manohar Lal Khattar said salaries of all those engaged in the fight against COVID-19, be it doctors, nurses, paramedical staff, Class 4 staff, ambulance staff, testing lab staff, will be doubled. He said this will be applicable till the coronavirus period ends.
इस इलाज के साथ जुड़े हुए जितने भी लोग हैं, चाहे वो डॉक्टर्स हैं, नर्सेज हैं, पैरामेडिकल स्टाफ है, क्लास 4 का स्टाफ है, एम्बुलेंस का स्टाफ है या टेस्टिंग लैब का स्टाफ है, कि जब तक ये कोरोना इसका पीरियड चलेगा तब तक ये सारा स्टाफ जो सीधा सीधा कोरोना के पीड़ित मरीजों की कोविड के इलाज में लगे हैं या उनके संभालने में लगे हैं, इनकी सैलरी अब डबल रहेगी.
He had earlier announced that these professionals will get ex gratia benefits between 50 lakh rupees and 10 lakh rupees if they are not covered under the new insurance cover announced by the centre. The Uttar Pradesh government today transferred 1,000 rupees in the accounts of those small vendors and labourers whose life and earnings have been affected by the lockdown. Chief Minister Yogi Adityanath electronically transferred the money directly into the account of 4,81,000 such vendors of urban areas.
These beneficiaries include auto drivers, rickshaw drivers, e-rickshaw drivers, street vendors and other daily wage laborers. On this occasion, Chief Minister Yogi Adityanath said that the state government is taking care of all those poor people whose livelihood has been affected by this lockdown. In this context, in the first phase, more than 11 lakh construction workers in the state have been provided rupees 1,000 each in their accounts. He said that under the Pradhan Mantri Garib Kalyan scheme, state government government is providing money and ration along with cylinders to the needy people. Meanwhile, out of 390 samples tested yesterday at King George Medical University, KGMU in Lucknow, 5 have been tested positive for COVID-19. Sushil Chandra Tiwari, AIR News, Lucknow.
In Bihar, 6 areas of Siwan, Begusarai and Nevada districts have been declared as hotspot areas of the state in view of increasing cases of coronavirus. 60 positive cases have so far been reported in different parts of the state. Out of these, maximum 29 are from Siwan. In this district, 23 persons are of a single family who came in contact with one of their family members who had returned from Oman. Director General of Police Gupteshwar Pandey said all entry and exit points of hotspot areas have been sealed. More from our correspondent.
All entry and exit points of hotspot areas have been sealed. 8 companies of Bihar Military Police BMP have been deployed in affected areas to enforce lockdown effectively. Border of all sides of 43 villages under 10 blocks of Siwan district has been sealed in Begusarai. 4 places have been identified as hotspot areas after 2 positive cases of Tablighi Jamaat. Sample of 11 Jamaatis was taken in Mukama areas of Patna district. They have been sent for quarantine. Meanwhile, Chief Minister Nitish Kumar has appealed to people who have returned from other states or abroad not to hide their travel history and voluntarily come up for the screening. With report KK Lal from Patna, Aarti Malhotra, AIR News, Delhi.
In Jharkhand, the total number of corona positive cases has gone up to 14. One new case has been detected from Chandrapura area of Bokaro district. The 33-year-old man is reported to be the neighbor of the first positive case detected from the district. The civil surgeon confirmed that the man has been quarantined earlier and he has been shifted to the COVID-19 special ward at Bokaro General Hospital. A 75-year-old man of Gomia area in Bokaro died yesterday due to coronavirus. Altogether, there are new 7 cases from Ranchi, 6 from Bokaro and 1 from Hazaribagh. These areas have been sealed and are being sanitized. More from our correspondent.
38 foreign nationals associated with Markaz and Tablighi Jamaat in New Delhi, arrested from various mosques across the state, have been put under quarantine center in Khelgaon in Ranchi, while one woman who has been the first positive case in Jharkhand has been kept in COVID-19 isolation ward in RIMS. All these TJ workers had come on tourist visas and were preaching religious faith in different parts of the state. They have been booked under violation of visa rules, National Disaster Management Act, Epidemic Diseases Act and lockdown norms. Most of the charges are non-bailable and these TJ workers will have to spend time in jail once they complete their quarantine period. This is Shilpi for All India Radio News from Ranchi.
In Assam, the first death due to COVID-19 was reported last night. Assam Health Minister Himanta Biswa Sarma informed that a 65-year-old patient passed away at Silchar Medical College. A total of 28 positive cases have been found in the state so far. More from our correspondent.
The Chief Minister also asked them to frequently send a message to the communities that lockdown is essential to prevent the spread of COVID-19. Meanwhile, Kamrup Metro District Administration has decided to allow door-to-door sale of fish and mutton in Guwahati city. On the other hand, Guwahati police has restricted the movement of permitted vehicles engaged in essential services within Guwahati city for initially 3 days from today by introducing odd event system. Manas Pratim Sharma, AIR News, Guwahati.
In Madhya Pradesh, the number of patients infected with coronavirus has reached 425. The maximum number of 221 patients are in Indore. The number of corona-infected people in Bhopal has increased to 112 after 14 more patients were reported today. 34 people have died so far. The state government has decided to provide free ration to about 32 people who do not have ration cards. A report.
In view of the corona crisis, free ration will be given to 32 lakh people of the state who do not have eligibility slips under the National Food Security Scheme. Such people will be provided 1 month free ration from the quota of state government. 4 kg wheat and 1 kg rice per person will be given to these people. The Principal Secretary, Food and Civil Supply, Shiv Shankar Shukla, informed that for the distribution of food grains, more than 12,000 metric ton of wheat and around 3,000 metric ton of rice have been released from the state level for these 8 lakh families. All such persons will be able to get ration as per their convenience from the nearby fair price shop. Collectors have already been instructed to ensure social distancing and other protective measures strictly during the ration distribution. Sanjeev Sharma, AIR News, Bhopal.
In Gujarat, the total number of coronavirus cases rose to 308 today, with 46 new patients being found today. The State Health Department said the death toll also went up to 19, with 2 more persons succumbing to the viral disease today. Our correspondent reports that out of the 46 new cases, 11 were reported from Ahmedabad, 17 from Vadodara, 5 from Rajkot, 4 each from Bharuch and Bhavnagar, 2 each from Patan and Kutch, and 1 case from Gandhinagar district. So far, 30 cured patients have been discharged from the hospital. Principal Secretary of Department of Health Dr. Jayanti Ravi said a total 978 samples have been tested in the last 24 hours. Out of these, 67 cases were found positive, while 635 cases were found negative, and reports of 276 cases are pending.
In Maharashtra, the number of COVID-19 patients rose to 1,380 today, with 16 more new cases. The State Health Minister Rajesh Tope has expressed concern over the rising number of cases in the state, especially in the Dharavi area of Mumbai. 5 more cases were reported from Dharavi, taking the total number of cases to 22. 2 nurses are also found positive in a hospital in Dadar West. Pune is in the second place, showing rising trend in positive cases. The state has decided to apply new measures for effective enforcement of lockdown, especially in congested areas like Dharavi, and also to curb the spread of misleading messages. A report.
Maharashtra government is leaving no stone unturned to contain the COVID-19 outbreak, but the increasing number of positive cases from Mumbai and Pune are adding to the worries of the government. The state government has decided to deploy SRPF to strictly implement lockdown in the congested areas identified as containment zones. Schools will be used as temporary shelters for people living in highly congested areas, as well as for community kitchen for those who have lost jobs due to the lockdown. The state government has decided to use fire brigades powerful jet spray to sanitize the public toilets in densely populated areas every 1 hour. An order has been issued to lock down 5 central prisons in Mumbai, Pune and Thane districts to prevent the spread of coronavirus among inmates. Similarly, main vegetable markets like APMC in Navi Mumbai will be kept closed from tomorrow. Shailesh Patil, AIR News, Mumbai.
In Kerala, even though the COVID-19 cases are not showing a considerable rise, the state is not easing its preparedness and efforts to contain the disease.
A total of 357 COVID-19 cases are confirmed in Kerala, of which 97 people recovered and 2 succumbed to the disease. Presently, 258 active COVID-19 patients are there in Kerala. Even as the number of people under observation came down to 1,35,000 from 1,70,000 few days ago, Kerala is not leaving any stone unturned in its fight against COVID-19. The state has won ICMR approval for the clinical protocol exploring the feasibility of an experimental therapy, convalescent plasma transfusion, which may be administered to the severe COVID-19 patient. Meanwhile, Christians in Kerala observed Good Friday, commemorating the crucifixion of Jesus Christ by following the COVID-19 protocol today. People watched the online streaming of prayers from church and engaged in small prayers at their own home. Mayusha, for AR News, Thiruvananthapuram.
Good Friday is being observed today by Christians all over the world to mark the crucifixion of Jesus Christ and his death at Calvary. It is observed on the Friday before Easter Sunday that marks the resurrection of Jesus Christ. It is also known as Holy Friday, Great Friday, Black Friday and Easter Friday. Prayers are being held in churches and chapels. Prime Minister Narendra Modi said Lord Christ devoted his life to serving others. In a tweet, the Prime Minister said Lord Christ's courage and righteousness stand out, and so does his sense of justice. He said on Good Friday we remember Lord Christ and his commitment to truth, service and justice.
Followers of the Christian community today offered their prayers, midnight masses and Maundy Thursday through online live streaming of prayer videos by the Archbishop to prevent the spread of COVID-19 on the eve of Good Friday. Amidst the coronavirus pandemic, Archbishop Felix Topo told AIR News that the churches had been given instructions to conduct the prayer masses through online prayers. The Archbishop said they have advised people not to visit the churches and offer their prayers through online live streamed video.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi says India is ready to provide all possible help to its friendly nations in the wake of the COVID-19 pandemic. Asian Development Bank assures India of $2.2 billion support to fight the pandemic. UN Chief Antonio Guterres says implications of pandemic will be far-reaching, affecting international peace and security. Centre and state governments making all efforts to identify hotspots to contain spread of COVID-19. and Good Friday being observed across the globe today. With that, we end the Midday News.